Welcome to Venta Care Center's Health and Safety Committee member training. Learning outcomes. Understand more about what safety culture means at Venta Care Center and what our health and safety program looks like. Describe the Internal Responsibility System, or IRS, and understand the different levels of responsibility in the system. Explain the purpose of the OHS Act, regulation, and code. Summarize and describe the duties, roles, responsibilities, and unique needs of a Health and Safety Committee and committee membership. This includes explaining the 3 basic rights of all workers. What to do if a worker has reasonable cause to believe that the work presents an immediate, imminent, or serious threat to the health and safety of themselves or others. Explain the Health and Safety Committee members' role in hazards assessment and methods of control. Explain the Health and Safety Committee members' role in workplace inspections, and understand more about Venta Care Center's workplace violence and harassment plans, policies, and procedures. A culture of safety at Venta. At Venta, we are committed to creating a culture of safety, which is reflected in the overall value it places on creating and maintaining a safe environment and in the actions and behaviors of its workers, supervisors, managers, and Health and Safety Committee members. Venta demonstrates its commitment to safety in a variety of ways that include promoting the physical, psychological, and social well-being of all employees and protecting them from factors and conditions adverse to health and safety by ensuring staff are provided the education and resources to perform their job in the safest way possible. Proactively mitigating risk to reduce incidents and injury. As you'll learn more, workplace inspections are one of the ways health and safety hazards or potential hazards are identified early. Supporting early and safe return to work initiatives. Encouraging workers to report unsafe conditions, and communicating openly about health and safety in a number of ways that include posters, bulletins, training, education, meetings, one-on-one discussions, and through Venta's policies and procedures. As a Health and Safety Committee member, you have an important role in promoting and supporting a positive safety culture. Some of the ways you can do this is by providing a voice for worker safety concerns, helping the employer understand safety issues and develop solutions, and integrating safety into all aspects of the workday. You'll learn more about your vital role in the organization in this module. Venta Care Center's Health and Safety Program. Venta Care Center has taken due diligence to prevent injuries or incidents in the workplace and comply with legislation by establishing a prevention program. Due diligence means that the employer is taking all reasonable precautions under the circumstances to prevent injuries or incidents in the workplace. Venta has a health and safety program in place to integrate health and safety into everyday practice, promote health and safety, and reduce the risk of injury and illness in the workplace. Our program complies with the Continuing Care Safety Association's Partnership in Injury Reduction, or PIR program, and is made up of 10 core elements focused on continuous improvement in occupational health and safety. Elements include orientation and training, emergency response planning, and hazard assessments and controls. Venta's Occupational Health and Safety Program is reviewed and audited annually by a certified internal auditor and every 3rd year by a certified external auditor to ensure our system complies with provincially recognized standards. A Certificate of Recognition, or CORE, is awarded for meeting all standards. In addition, to have an effective health and safety program, it's important to understand the Internal Responsibility System. We'll talk more about this in a moment. But first, let's talk a little bit about Venta's health and safety policy and procedures. We have a health and safety policy that is reviewed regularly. A written occupational health and safety policy helps define and promote an effective health and safety program. It informs everyone in the organization how Venta shows its commitment to health and safety. The policy covers, among other subjects, that the employer is ultimately responsible for worker health and safety, the worker's responsibility to maintain a healthy and safe workplace for all, Venta's commitment to complying with all applicable OHS legislation, and Venta's commitment, method, and actions used to eliminate hazards and reduce risk. Please pause the video now and review Venta Care Center's Health and Safety Policy and Procedure in your Health and Safety Committee member education package. Now, more about the Internal Responsibility System, or IRS. The IRS is the model for the Alberta Health and Safety Act and founding principle of the OHS system, which states that everyone is responsible for health and safety in the workplace. Workers, supervisors, and managers have specific roles in maintaining a safe and healthy workplace and improving unsafe working conditions. Everyone is accountable for carrying out their responsibilities and has the right to know what those responsibilities are. The higher your authority in a company, the greater your accountability is to health and safety. Health and Safety Committee members are an integral part of the IRS, and the committee cannot function without active participation of workers. Let's take a look at some of your responsibilities at Venta according to the IRS, depending on if you are a worker, manager, or supervisor. Workers are responsible for reporting unsafe acts or conditions when observed to the supervisor or manager, protecting the health and safety of themselves and others in or near the facility, complying with Venta's safe work practices, health and safety policies, and OHS legislation, and participating in the health and safety program at Venta, including training, workplace inspections, etc. Supervisors and managers are responsible for ensuring workers are aware of any hazards and that hazards brought to their attention are responded to, ensuring the health, safety, and welfare of workers and other individuals in or near the facility, proactively identifying hazards and implementing strategies to reduce the number of work-related injuries, illnesses, property damage, and workplace violence and harassment incidents, ensuring workers have and use the resources, training, and controls for their role to work in a healthy and safe manner, and preventing workplace violence and harassment. OHS Act, Regulations, and Code. The Occupational Health and Safety, or OH&S Act, gives the government authority to make rules about health and safety in any workplace. Under the legislative framework, the OH&S Act prescribes basic duties and obligations of employers and workers. Section 2 of the Act lists its purpose as follows: the promotion and maintenance of the highest degree of physical, psychological, and social well-being of workers, to prevent worksite incidents, injuries, illnesses, and diseases, the protection of workers from factors and conditions adverse to their health and safety, and to ensure that all workers have the right to be informed of worksite hazards and the means to eliminate or control those hazards, the right to meaningful participation in health and safety activities pertaining to their work and work site, including the ability to express health and safety concerns, the right to refuse dangerous work, and the ability to work without being subject to disciplinary action for exercising a right or carrying out duties imposed by OHS legislation. The OH&S regulation addresses requirements related to general administrative matters and health and safety rules and regulations. The OH&S Code specifies detailed technical standards and safety rules that employers and workers must comply with to fulfill their obligations. Technical requirements cover areas such as equipment safety, noise, chemical hazards, and first aid, to name a few. Throughout this module, you will note multiple references to specific areas of the OHS Act, regulations, and code. Copies of current Health and Safety Act, regulations, and code are available on each nursing station and on the OH&S board if you want to learn more about this legislation. Health and Safety Committee, HSC, and members. The Health and Safety Committee, also known as the Joint Health and Safety Committee, is required by law for work sites with 20 or more regularly employed workers. It is key to supporting and promoting a strong safety culture at Venta Care Center. The size of the committee is determined by the number of workers in the facility, the types or degrees of hazards, the number of departments, and the number of shifts. As per the OHS code, the Health and Safety Committee must consist of workers and employers. Half or more of committee members must be workers. There must be a fair and equitable representation of worker members, those who do not supervise other workers, and employer members, those who direct the work of others, from different departments and roles within the organization. As an HSC member, your goal is to motivate and influence change within the organization by, among other things, encouraging worker involvement, promoting awareness and interest in health and safety, leading by example, supporting a worker's 3 rights, and offering solutions. More on a worker's 3 rights coming up shortly. The HSC must have 2 co-chairs, a worker co-chair selected by the worker members and an employer co-chair selected from the employer members. A list of all members, including co-chairs, is provided on the OH&S board for reference. As per OHS code, an HSC must establish a terms of reference, which is a written set of procedures detailing how the committee should function. For more information, refer to Venta's Terms of Reference, which outlines the committee's membership, selection process, and structure, the roles and responsibilities of its members and terms of office, the frequency for committee meetings and how meeting records are maintained, and the dispute resolution process for when committee members cannot agree on a recommendation. Please pause the video now and review Venta Care Center's OH&S Committee Terms of Reference in the Health and Safety Committee Member Education Package. Joint Health and Safety Committee meetings are held quarterly each year at a minimum. Check out the OH&S board for the next upcoming meeting. Remember, all staff who wish to participate are encouraged and welcome to do so. During a meeting, Health and Safety Committee members will review, among other things, worksite inspection reports, incident investigations, training and education, and hazard identification reports. Meeting minutes, action list, and outcome summary based on findings from the worksite inspection are posted on the OH&S board for all staff to reference. Let's talk a little bit about the different categories of health and safety incidents and what you as a Health and Safety Committee member may be responsible for. Venta is responsible for investigating all incidents that include workplace illnesses, potentially serious or serious incidents, work refusals, or near misses that affects or has the potential to affect workers, equipment, or the environment. After investigating an incident, the Health and Safety Committee member or management will determine the root cause of the incident and implement actions to prevent incidents like this from recurring. You, as a Health and Safety Committee member, may be asked to participate in the investigation. A serious incident is a situation that requires treatment at a hospital or, unfortunately, an incident that was beyond treatment. A potentially serious incident is a situation involving injuries but does not require hospitalization or a near miss and that could have resulted in a serious incident. Both of these types of incidents are required to be reported to the government. Health and Safety Committee member duties. Let's take a closer look at some of your duties as a Health and Safety Committee member at Venta Care Center. Make recommendations about worker health and safety to the employer. More information on these recommendations will be coming up shortly. Represent members of their department on the committee. Prepare for quarterly committee meetings by touring their primary work areas and ask workers for any input or suggestions for the safety program. Participate in formal workplace inspections and review employers' hazard assessment. Receive and address concerns and complaints about the health and safety of workers. Help the employer understand them and assist in resolving the concern or complaint. Participate in incident investigations, work refusals, serious injuries, and incidents with management. Participate in the consideration and resolution of health and safety concerns or hazards to workers, and assist with the creation, maintenance, and communication of hazard assessments and control measures to keep workers safe. Please pause the video now and review the full list of duties and responsibilities of an HSC member in the HSC Member Education Package. Members have a responsibility to make recommendations about worker health and safety to the employer. All committee members, both workers and managers, work together to identify and solve health and safety concerns. This is an important part of the internal responsibility system as discussed earlier and ensures that everyone is aware of their responsibility for health and safety. As a worker, your recommendations to your manager about health and safety concerns should contain as much helpful detail as possible. Consider the nature of the problem, the risks of not addressing it, recommended solution both in short-term and long-term, solution costs and time required, pros and cons for each recommendation, possible consequences if nothing is done, and getting other workers' feedback. The 3 rights of workers. Under the Occupational Health and Safety Act, workers have 3 basic rights to protect themselves and others from injury and/or illness. Let's take a look at what those 3 rights are. Right to know. Workers have the right to know what may cause them to get hurt, hazards, and what has been put in place to keep them safe, controls, including access to basic health information, any education or training required to keep them safe, and required supervision while performing tasks, if applicable. Right to participate. Workers have the right to participate in meaningful health and safety activities. This includes expressing health and safety concerns, being involved in decisions that affect their safety at work, and participating in the HSC. Right to refuse dangerous work. Workers have the right to refuse work if they reasonably believe there is an undue hazard, a serious and/or immediate threat to health and/or safety. For example, a situation where a worker isn't properly trained, equipped, or experienced to handle. General health and safety concerns are not dealt with under the work refusal process as they are not undue hazard. As a member, you are responsible for ensuring all workers have these rights fulfilled. Work refusal process. How does the work refusal process work at Venta? A worker that reports a work refusal to you needs to be reported to management, investigated, and responded to promptly. The circumstances surrounding the work refusal, details of the hazard, and any actions to remedy the undue hazard shall be documented by the member. Venta management may decide to assign the refusing worker to different work during the work refusal process. The refusing worker may be asked to resume work if the undue hazard has been remedied. If the refusing worker still thinks there is an undue hazard, they may notify Occupational Health and Safety. Venta will be required to advise any other worker or workers assigned to the work of the worker's refusal, without identifying the name of the worker, the reason they refused, and the reason there is no undue hazard. Section 31 of the Occupational Health and Safety Act outlines that a worker has a right to refuse dangerous work and is protected from reprisal for exercising this right. Hazard assessment, identification, and control. The formal identification of hazards at work is critical to building a health and safety program. As per Part 2, Section 8 of the OHS Code, workers must be involved in the assessment, control, and/or elimination of hazards identified. HSC members can assist in the identification of hazards to workers in connection with the activities they perform. An HSC member may also assist in developing and promoting measures to protect workers' health and safety and assess the effectiveness of such measures Venta has put in place to do so. A workplace hazard is a situation, condition, or thing that may be dangerous to the safety or health of workers. Hazards in the workplace can be related to health or safety. A health hazard is anything that could cause harm to someone's health either right away or over an extended period. Examples include radiation exposure, communicable diseases, loud noises, or chemicals. A safety hazard is a substance, process, action, or condition that has the potential to cause injury or damage. Examples include slippery floors, falling objects, moving or lifting patients, or workplace violence. Workplace hazards are grouped into 4 categories. 1. Biological hazards are hazards caused by an organism or substances produced by organisms that may pose a threat to health and safety, including viruses and bacteria. For example, exposure to a resident with influenza. 2. Chemical hazards refer to substances that cause harm to health and safety, like gases, drugs, or other chemicals. This may include chlorine gas, cytotoxic drugs, or cleaning supplies. 3. Physical hazards. When an object, equipment, or material comes into contact with an employee, causing injury. Examples: awkward postures such as reaching across a resident's bed to perform personal care. Highly repetitive motions, for example, crushing medication. Static and/or fixed positions, for example, sitting and/or standing for long periods of time. Lifting heavy loads. Physical aggression by a resident. Wet floors or slippery sidewalks. And moving parts of machinery, for example, a mechanical lift. And lastly, 4. Psychosocial hazards. These are hazards that can cause workers mental distress or distraction and include employee stress due to resident illness and/or death, employee fatigue due to shift work, harassment and/or bullying, or compassion fatigue. There is a written hazard assessment for every position at Venta that lists all the potential risks and hazards of each task an employee is required to perform, and the controls in place to either eliminate or reduce the risk of the hazard, to control the hazard, as per OHS code. There is a hierarchy of controls where the most effective method would be to control the hazard at the source. Controlling a hazard at the source would require us to determine if the hazard can be eliminated by removing the hazardous job, tool, process, machine, or substance. If not, we could look at other methods including substitution, doing the work in a less hazardous way, for example, substituting a hazardous chemical with a less hazardous one, isolation, isolating the hazard from the worker, redesigning the layout of the work area or work process to prevent ergonomic hazards, or automating the process, for example, the use of a dispensing machine to mix chemicals. If the hazard cannot be controlled at the source, then we must control the hazard along the path to the worker or at the worker using Number 1. First choice. Engineering controls. These control the hazard at the source. Examples of common engineering controls used at Venta are mechanical lifts, sharps containers, carts, dollies, and pulleys, adjustable height beds, and lightweight mop heads. Number 2. Second choice. Administrative controls. These control the hazard along the path between the hazard and the workers. Examples of common administrative controls used at Venta are safe work practices and procedures, signage, training and supervision, job rotation to limit exposure time, and scheduled rest breaks. And number 3, third choice, personal protective equipment, or PPE. These control the hazard at the worker. Examples of common PPE controls used at Venta are respiratory protection, gloves, protective clothing, and eye protection. If the hazard cannot be eliminated or controlled using a single control method, a combination of engineering, administrative, and personal protective equipment can be used together to promote worker health and safety. Creating a formal hazard identification assessment and control includes: Step 1. Identify the risk. Example, interacting with residents. Step 2. List all the hazards you can see and those you cannot when doing this task. For example, what are the ways you may get hurt or sick while interacting with residents, such as daily psychological stressors, such as behavior-related stress, resident care needs, etc., exposure to germs and/or viruses, or resident violence and/or harassment, either physical and/or verbal. Step 3. Determine the risk of each hazard and prioritize them. We will give them a value of 1 to 4 in each of their risk categories: frequency of exposure, severity of potential loss, and probability of loss, and the total will be added up. The higher the number, the higher the risk. All workers need to know the hazards associated with their position and the controls in place they are to use. The hazard assessments, or HA, for each position is provided upon hire, and copies are available for reference at any time on the OH&S board, which is by the 300-400 unit. As per OHS Code Part 2, the HA is required to be reviewed at set intervals. At VCC this is done: Number 1, annually by all employees. Number 2, when a new work process is introduced. And number 3, when an inspection identifies a new hazard. Each hazard is categorized by type: biological, physical, psychological, chemical, and given a priority ranking of low, moderate, or high based on the total risk score. By identifying hazards or problems before they happen, you are doing your due diligence. Hazard identification and control should be part of everyone's daily routine. Some things to consider: is the hazard foreseeable? Is there something that can be reasonably done to stop the hazard? Have I alerted others of the hazard and informed my direct supervisor about it? The Health and Safety Committee member is largely responsible for ensuring Venta has taken due diligence to prevent injuries or incidents in the workplace. As an HSC member, you need to monitor the effectiveness of corrective action and/or controls in place and report to HSC. Workplace inspections. A workplace inspection is a planned walkthrough or observational assessment of the facility's interior and exterior environment, and observation of how workers perform their task or tasks to ensure existing hazards controls are used and effective, identify new and uncontrolled hazards, identify potential problems with equipment, identify changes to the work environment, and create a positive safety culture by showing employees that their health and safety is important. Venta's workplace inspection process involves making observations, communicating results, implementing corrective actions if required, and assessing those corrective actions to ensure they are sustainable. Inspections are classified as formal and informal. Formal workplace inspections are conducted quarterly prior to HSC meetings. They are led by HSC members and carried out with meaningful involvement of other workers, managers, and supervisors. They follow an established process using a health inspection checklist as a guide for every department and/or location, including resident care areas, med rooms, housekeeping rooms, and therapy areas. As an HSE member, your participation in formal inspections supports the overall health and safety of the facility. As a member of the worker group, you are better able to recognize potential gaps in safety that may have been overlooked. You can identify discrepancies between workplace practices and VCC standards, assess potential root causes for gaps, develop recommendations for corrective actions, and evaluate those corrective actions. Additionally, your presence, communicating health and safety concerns with employees, reinforcing safe work practices, etc., emphasizes Venta's commitment to health and safety. Conducting a formal inspection. The member leading the inspection shall ensure he or she has items readily available before the inspection, including a copy of the inspection checklist, pen and extra paper for additional documentation, a camera to capture a specific hazard if needed, and a flashlight to better see tight corners. Notify the workers, managers, and supervisors in the area that you are conducting a workplace inspection. Remember you are observing both the behaviors of staff, how staff are performing work tasks with respect to acceptable safe work practices, as well as the surrounding workplace conditions, the physical condition of the workplace and/or equipment. 1. Assess all workplace elements. Environment: lighting, noise levels, temperatures, clutter, etc. Equipment: condition of equipment being used, for example, imbalanced carts, frayed slings, etc. Materials: observe chemical storage, handling, and use of supplies. Behaviors: observe workers' competency, compliance with procedures, compatibility with activities. For example, are they using proper body mechanics when lifting, wearing appropriate PPE, etc.? Two, follow a regular sequence. Look around. Look right, left, up at ceiling, cupboards, etc., down at baseboards, floors, etc., and inside storage cabinets, cupboards, etc. 3. Check equipment operation. Do staff need excessive force to move the equipment? What is their posture? Are they using proper body ergonomics? Are they pulling versus pushing? 4. Identify dangerous work. If you identify any serious risk or danger, for example, a flammable item near a heating unit, do something right away. Fix the problem or call someone to assist you. 5. Talk to workers. Identify yourself to employees in the area. Give them an opportunity to discuss their health and safety concerns or input. Six, report and document findings. If there is something that needs to be logged in the maintenance book, do so. If there is something that you can fix immediately, do so. Either way, document all findings, take pictures if needed, and give a clear description of the exact location of the hazard and how it was fixed, if applicable. All workplace inspection leads will review their findings and/or discuss corrective steps at the Health and Safety Committee meeting. The review will include decisions on effective controls, reconsidering how a task is done, and how to communicate this information to everyone who needs to know. Relevant information from these inspections should be added to the formal hazard identification and assessment, if not listed already. Important: look for not only what is wrong, but what is right. When you see good conditions or behaviors, include them in your inspection report. Let workers know that they are doing well, and recognize them for maintaining safety. Informal workplace inspections. All workers are expected to be aware of potential hazards in their work area and conduct informal workplace inspections throughout their workday. Both managers and supervisors conduct regular rounds in their work area and/or departments to assess for hazards. Workers should assess conditions before starting a task and while performing their work. Identified hazards should be rectified immediately, if the worker is able to do so, or reported to your direct supervisor by submitting a yellow internal concerns report. Venta management will ensure that corrective actions are taken on a timely basis. This reinforces the message that health and safety are a priority at Venta and encourages workers to continue to report hazards. As per OHS regulations, a worker is required to immediately report to their employer equipment that is in a condition that will compromise the health or safety of workers using or transporting it, will not perform the function for which it is intended or designed, is not strong enough for its purpose, or has an obvious defect. Identifying workplace violence and harassment risks and controlling hazards is necessary to promote a positive work environment. Violence, whether at the work site or work-related, means the threatened, attempted, or actual conduct of a person that causes or is likely to cause physical or psychological injury or harm, and includes domestic or sexual violence. Domestic violence is a pattern of behavior used by one person to gain power and control over another with whom they have or have had a personal intimate relationship. Harassment can take the form of any single or repeated incident where a worker is the target of an unwelcome or objectionable comment, conduct, or bullying. It does not include any reasonable conduct by a manager or supervisor regarding the management of workers or the worksite. Venta has a responsibility to prevent and manage workplace violence and harassment. The OHS code states that an employer must develop and implement a violence prevention policy and plan in consultation with the HSC and has a harassment and violence prevention plan in place. The OHS code states the employer must develop a harassment prevention plan in consultation with the Health and Safety Committee. The plan must include a harassment prevention policy and procedure. The OHS code states that an employer must develop and implement a violence prevention policy and procedure in consultation with the Health and Safety Committee. The OHS code directs employers to review the violence and prevention plans in consultation with the HSC and revise if needed when the earliest of the three following circumstances occurs. An incident of violence occurs, when the HSC recommends a review, or once every 3 years. Employers must ensure workers are not subject to or participate in harassment or violence in the workplace, protect the health of workers, investigate any incident of violence and/or harassment, and take action to address it and prevent it from recurring. Supervisors must ensure workers under their supervision are not subject to harassment or violence at the workplace. Workers must refrain from causing or participating in harassment or violence. Please pause the video now and review Venta's harassment and violence prevention plans in the HSC member education package. Congratulations! You have now completed the Health and Safety Committee module. Replay the video or click on the Take Quiz Now button below if you are ready to test your knowledge.